Do you welcome Sajid Javid's statement and the Cabinet's decision?
I do, and I think, with regard to your previous remarks, I think it's good politics and it's good news for the country. It gives business and the public the certainty they need that there'll be no new restrictions before New Year. People can plan their businesses, order their supplies, and schedule their staff. And the reason that we haven't got any new restrictions is the excellent news that the data that the Prime Minister is being given doesn't support that. Yes, infections are up, but hospitalisations with the Omicron variant are relatively low. People are also not suffering a lot of severe illness. They're in hospital for less time, and thankfully there'll be fewer deaths.
At what point do you say it's all over? We can move on, we can move forward?
Well, Omicron, the centre of the infection has been in London. We've managed in London to cope with all of this, despite the fact that, quite shockingly, a third of people in London actually have taken no vaccines whatsoever. So if we can cope in London, as it spreads out to the rest of the country, we should be able to cope actually rather better than we have done in the capital.
You said that you were cautious when you talked about the hospitalisations. My understanding is that we can deal with almost any number of infections so long as it doesn't lead to an increase in hospitalisations. It did, albeit modestly, and still in the 7,000 territory. Are party politics playing too big a part in these decisions?
No, not at all. I think I've said to you before that, lockdown restrictions, there's a lot of collateral damage to wider society, the fabric of our society, mental health, and of course the economy. I think we need to use them as very much a last resort, not a first resort. If the NHS can cope, and if they've coped in London, I'm confident they'll be able to cope in the rest of the country. I think the biggest threat to the NHS and every business and every organisation, it will be absenteeism due to self-isolation of people who have contracted the Omicron variant. It is highly transmissible. That's why the government, and I welcome the fact they've cut the self-isolation from 10 days to 7 days. I would actually go further. I'd lateral flow test people every day. And if they don't have virus particles in their nose or their throat, given this is a respiratory disease, clearly they're not transmissible. If they feel well enough, I think they should be able to return after 3 days of negative testing.
Some of those absentees in numbers are in the health service itself and also in the education sector, with schools due to return in fairly short order. I mean, those are serious concerns. They're not incidentals.
No, it is highly transmissible. But the good news about that is that it's going to peak very quickly. If it's similar as we expect to how it occurred in South Africa, 3 weeks from the first infections, it will peak. It will certainly probably do that in London, and it'll peak in the rest of the country sometime after that. In which case, we could be out of this situation in 6 weeks. And also, infections in South Africa rose very, very quickly. It's highly transmissible, but they also dropped very quickly as well once you pass the peak. And I think we're going to be about there now.